Hi, my name is Dr. Robert Antolak. I'm the president and owner of thegentledentist.com, located out in Shelby Township, Michigan. Our phone number is 586-247-3500, and our website is thegentledentist.com. We provide a full array of treatment at our office at thegentledentist.com, including something what I like to talk to you today is issues that people have to do with sleeping and sleep apnea and snoring and sleep disorders. You know, it's a major problem in our country. There are more than 87 million Americans who snore. That's huge. That's about 30% of Americans snore. And then those who snore, about 40 million have sleep disorders, and about 40 million suffer from sleep apnea. So, and what is sleep apnea? Sleep apnea is a disorder where people will actually, they breathe usually through their mouth, and then they'll develop a problem with snoring, and the snoring is where the soft tissue of the palate, the roof, and the back of the mouth, as you can see on this diagram here, where everything starts to collapse in, and then it doesn't allow for air to go down it. So as they're starting to breathe, they start getting snoring, and then the snoring may just stop for about 10 seconds. Now, if you're a bed partner or spouse with one of those people, you can get kind of panicky, especially when you hear it, 10, 15, 20 times an hour. And every time you hear that, the body is literally stop breathing. Then the body has to then increase its adrenaline level in the body to then help to keep keep you breathing. And so that over time can create all kinds of problems. For example, heart disease is more prevalent in people who have sleep disorders like sleep apnea. Stroke, because of this adrenaline rush that takes place in the body while somebody's sleeping, because your body needs to wake itself up so it can get air, do its most primary thing to survive, which is to breathe. Well, every time you wake yourself up, there's a surge of adrenaline. That adrenaline will start making the heart beat faster. Therefore, you can have risks of heart attacks, strokes, heart disease, and even diabetes is even affected by that because it affects within the circulation. But what's really important is to know that there's help out there. Number one is that you're probably, if you're listening to this, you're more than likely one of the people who are suffering from this, because only about 10% of those who have this issue have been treated. Only 10%. Most of the time, the treatment presents with what's like we call the Darth Vader mask, which most people have seen before. That's called a CPAP, which is it's a continuous positive airway pressure. So it's basically a pressurized mask that continually forces air down into the lungs to breathe. And that is the gold standard. But it is not the best thing that you can do if you can't tolerate it. Because most of the time, the biggest issue that we have with our patients, or any patient for that matter, is tolerating the fact that they have to then keep this thing in all this noise that comes with it. And a lot of people can't tolerate it. So the other option that we have is using an oral sleep appliance. And what that is, it's something that goes in your jaw, and it moves your jaw forward. And then when it moves the jaw forward like this, it helps to open the airway up. When it opens the airway up, then it doesn't become a problem with that sleeping, and it provides for much smoother sleep. Well, there are some reasons why it's becoming much more of an issue in our country. It is because of the weight issues that we have in our country. Our country has such a very high obesity level. And the body mass index numbers have gone up over the years. And the reason why that's an issue with sleeping and snoring is because the more weight that people gain, the more tissues they actually have around their throat. And when they sleep, there's only a small amount of air that's available, space that usually is available. Well, if they collapse it in with fatty tissue, then that closes up pretty darn easily, especially when sleeping. One of the issues that people also have is when they do that, they never get into a deep level of sleep. Deep sleep is very important. It's very critical because what it does, it allows your brain to get into certain deeper wavelengths so that so you can get a deep rest. When people don't get enough rest, there's many problems that can develop. For example, they can be in traffic accidents, much level of traffic accidents that can take place because they fall asleep at the wheel. If you find yourself at a red light, or even at a red light and feeling kind of dozy, or if you're the type of person who's a passenger in a car and you feel like you want to fall asleep, you might want to get this checked out, because these are some of the indicators of people who have sleep disorders such as sleep apnea. And so the thing we need to do now is we actually have on our website, on our first page, and we'll have a link hooked up here where you can actually fill out some forms to see what level of sleep apnea you may have and the importance of that. Now, the first thing that we'll do is, if you become a patient here, is we'll go ahead and we'll give your physician a letter to have a possible sleep study done. And a lot of this is covered under medical insurance. And then if you prefer to not wear the CPAP, then we can make an appliance that will help you keep your jaw forward so you can sleep well. So in conclusion, sleep apnea is a major issue. Snoring obviously affects the people that are next to you if you're the sleeper, or if you're the person who's maybe even awake right at this moment, trying to find out a solution for your spouse who's snoring. You know, this is a great possibility, and it really makes for much better relationships when both people can get a good, well-rested sleep. For more information, you can visit our website at thegentledentist.com, and you can also go to calling us up at our phone number, which is 586-247-3500. We're located out in Shelby Township, Michigan. Thank you.